Okay, Laurent right here and his wife are here today. When I said to you a long time ago that following my intervention at the National Kidney Cancer Congress, I would call it, organized by Bernard Escudier in Paris, there's more than 100 people have been following, and the very first one was actually Laurent. And he's got a history of a very aggressive cancer. He started chemo in 2016. That's when I met his wife. In fact, my first flight after illness, after 2 years of illness, was to Cape Town, and she was the chief purser of our flight. And she, well, you know, we just found out the stories, and she told me right away about her husband. And next thing, as soon as we got back, we got it, you know, over the Skype or telephone, and we discussed everything. So what I've put in place for him was exactly what we're talking about here since this morning, is a mix of the best I could do. Once again, it's the best I could do, and what I'm saying is that it's not my job initially. It is perhaps a new way of finding out things to help patients, make it easy for patients to understand things. So what I did is made a concept with anti-angiogenesis, with the first thing, which I think is the most important to start with, because everyone has to feed. And natural anti-angiogenesis, the concept of William Lee's, is the easiest by far to use as a patient without being monitored. Once you go through the reading, I offer them this concept mixed with ketogenesis, mixed with the fasting. I didn't want him to go to his oncologist saying nothing. I just told him to say everything. And the response from the oncologist right away was, he actually, I think he smiled and he said, I'm really glad you're talking about this to me. You're saying you're not hiding anything, because I also take spirulina and I also fast. Those were the words of the oncologist. So they had a relationship from the start, trying to get through his aggressive colon cancer.
Du côlon, ça a passé sur le foie. Et donc là, maintenant, j'ai un traitement qui cible, j'allais dire, davantage le foie.
So from colon cancer, it spread to the liver. I do remember now. And the very first thing that the oncologist proposed was a very aggressive chemotherapy to start with. And I remember him telling him that considering his weight, he was much thinner than that. Those type of chemotherapies were very aggressive, and that most of the time they would have to stop after 3 or 4 sessions. He had 12 of them. Not only he went through the 12, but he had, if I remember well, 0 side effects from the 9th one, 9, 10, 11, 12, which was a first for the oncologist. He doesn't remember seeing that. He didn't think it was going to happen. So Laurent is here today. He's going through his treatments. He's still following, apparently, to the letter. It's a teamwork, his wife as well, which is very difficult.
Oui, effectivement, si je peux me permettre, c'est une équipe, puisque, je veux dire, il faut parler de nos femmes qui nous supportent. Et voilà, donc je profite aussi d'avoir le micro pour remercier tous les scientifiques que tu as réussi à réunir aujourd'hui, et les remercier aussi, puisque c'est grâce à eux que nous avons ces traitements, et tout ce que vous pourrez nous apporter. Je veux dire encore un grand merci, un grand bravo à tous.
He can't thank enough the scientists that are present here today. If he's here today, that's because, you know, they're here. So he's very much aware that it's because of you guys. So a big thank you for being here today, for coming here.
So the idea was not to give too many testimonies, but I think that's one point, which is honestly when you are an oncologist on the other side, you say patients like him without any ketogenic diet, I know a lot of them who are still alive, and the question is what is related to his ketogenic diet, what is related to the chemotherapy he has, what is related to the immune system he might have because he's believing that ketogenic diet is working and so on. So that's really the point of this meeting, is how can we know whether his testimony is corresponding to something right or not, whether Jean-Jacques is alive without any cancer. Actually, I cross my fingers, so because of his style of life, I don't know. I think it might be. One thing which I certainly see from my patients who do this kind of diet is that the toxicity of the regimen seems to be much lower. So that's something that I've experienced at least. I don't know if it's more active, but the toxicity is certainly less. So that's one point. And what I want to do now is to ask all of you who are going to give some clinical data you have produced in your patients, really to give us, I mean, in 10 minutes, except Adrian was going to speak 20 minutes. In 10 minutes, what you faced as problem, what you have observed, why you are convinced it's working or why you are not convinced it's working, because that's really what we want to know here. And we are going to discuss this data afterward to know what is true, what is not true, what is a dream, what is reality, and that's really what we want to get. So we'll have a last testimony from a Scottish patient. So he's coming from Scotland. He's going to tell us in English his story. So
I'll do my best.
Sure.
Sorry about my accent. So my name is Archie. I'm a teacher, translator, computer consultant. Among other places, I teach in the IFSIs in Paris, the Institut de Formation en Soins Infirmiers, where nurses learn. I can sum up my experience in 6 key quotes. First of all, it was a giant sneeze that gave me esophageal cancer. What? Well, I was cooking, and the effort to block the sneeze caused all the muscles in my back to lock up. This gave me a monstrous case of lumbago, which was so bad that the osteopath could do nothing and sent me to the GP for anti-inflammatories. They had a side effect of giving me gastroesophageal reflux, which gave me, it went on for months and months. It gave me enormous difficulty in swallowing. I began to think it was an infection, so I tried a 3-day water fast. That didn't help. Then there was an endoscopy which showed it was squamous cell carcinoma. So my first quote, I went to see the gastric surgeon. He said, "You'll be eating a lot of ice cream." Have I switched that on? It's working, okay. You'll be eating a lot of ice cream. And I thought, this guy has never heard of Otto Warburg. So I agreed to a minimal chemo and radiotherapy to prepare me for surgery. But I resolved privately to add ketogenic diet to that. Anne, my wife, was superb. She prepared foods that I could swallow. There wasn't much. But she invented terrific soups. She food processed stews. She selected good cheeses that would go down easily. She made the most delicious guacamole. And she picked the right kind of patty. I really do owe my survival to her efforts. I added 3 cups of green tea every day because it's anti-angiogenic. And as much turmeric as I could put in the food without it being all tasting like curry. And of course, it's renowned for anti-cancer properties. So after the chemo and radiotherapy, which were bearable, I nonetheless had more and more difficulty swallowing. Sometimes food would get stuck for up to 48 hours, which is unpleasant when you're hungry and thirsty. So I told the radiation oncologist, I'm following a ketogenic diet. I've heard that it's good for people with cancer. And so he gave me my second quote. He said, "The ones who tried a ketogenic diet and died never wrote anything." Wow. So the gastric surgeon told me, the good news, we can operate on you. The treatment has worked exceptionally well. The tumour has shrunk hugely. And I asked, and what happens if surgery proves unnecessary? Third quote, don't kid yourself. Esophageal cancer always requires surgery. So the proposed surgery was brutal. It involved chopping out the bottom third of my esophagus and the top corner of my stomach, then sewing the two ends together. It would have left me with reflux for life. Not a good idea, was it? So, because of a mix-up with the next scan, I actually managed to cancel the surgery. And then the hospital lost me. I'm not saying which hospital. I don't see anybody from there here. So, in any case, they lost me for a couple of months. Then I got the results of the scan and arranged to see the oncologist again. My fourth quote, you've only done half the treatment. Oh. So I said, well, can we find out? Another round of tests, maybe? This, of course, was 7 months after the diagnosis and 5 months after the last treatment. The results were all negative. The oncologist gave me my fifth quote. You are as stubborn as a mule. And I said, but was I wrong? And I had to say, no. In July, after yet more tests, he gave me my final quote. I don't like to go there, but you're cured. Ladies and gentlemen, thank you.
Thank you very much. That was an awesome.